This video is going to be all about how you can get the best experiences and the best learning out of your clinical placements. This is predominantly going to apply to current medical students and aspiring medical students if you have some clinical work experience coming up, but also it's going to apply for any healthcare students really who have any kind of clinical workplace setting. And if you keep watching right to the end, I'm going to cover a little bit of bonus material about what you can do if you have nothing to do. So medical school in the UK can be traditionally thought of as having two separate parts. It's got a preclinical and a clinical. Those preclinical years, those are predominantly dominated by things like lectures, seminars, dissections and workshops. That's like face-to-face teaching, or although in the current age probably not face-to-face, but that's like rote learning and the basic sciences that you're going to need to build any of your clinical knowledge. The clinical section is just for that. It's for building your clinical knowledge, and it's dominated by clinical experiences. So whether that's in a hospital, a GP setting, maybe a psychiatric setting. More traditional universities, think Oxford, Cambridge and Imperial to a certain extent, they have a clean split between these two. They have preclinical years and then clinical years. Now this can end up with a lot of information being front-loaded onto students. So students have to learn pretty much all of the science behind a medical degree, including all of the anatomy, all of the pathology, all of the physiology, before they're even allowed to see any patients. In recent years, there's been more of a move towards what's called an integrated curriculum. So an integrated curriculum is what we have here at King's. And this curriculum, it combines those two. So there's much less of a clean split between preclinical and clinical. And so you're learning science while still having some sort of clinical experiences. And for me, this just works way better. At King's, you actually start your clinical exposure in your very first year. Then from the second year, you're actually in a hospital placement and a GP placement for 1 day a week. So 2 out of every 5 days, you're in a clinical experience. Third year is 3 days. And in fourth and fifth year, you're in every day of the week. Personally, I find this so much better than a more traditional course. And I think that's for one major reason. It's because while you're learning the science, you have context. I find it so hard to learn anything without any real context. If I'm just having to be told to memorize something or to learn something without knowing why I'm learning it, then it just does not stick in my head. I'm now in my 4th year at King's, or I'm in year 4 of the King's curriculum. It's actually my 6th year at the university, so feeling pretty old compared to some of the other people on my course. But I've now been in clinical placements for a long time, and I think I've got a hang of it. Here are my top 4 things to do at a clinical placement. Number 1's pretty obvious, and you're probably going to get a bit annoyed at me telling you, but turn up on time. And on time, it means early. Don't turn up at the placement at the time you're supposed to be there starting to do what you're doing. You need to turn up 5, 10, 15 minutes early, introduce yourself so people know who you are, and tell people what you want to get out of the day so that they can help you with that. If your timetable tells you to get to the geriatric ward at 9 AM because that's when the handover is, you need to get there before 9 AM so that you know where the handover is, and you can be standing there at 9 AM so you can have a handover sheet printed and in your hand ready to understand what's being said. And it's impossible to do that if you're arriving late. Arriving late not only, and quite obviously, means that you're missing out on experiences that you would have had if you were there, but it also means that you're just going to piss off whoever you're supposed to be working with. The clinical team, the healthcare professionals that are there, yes, it's part of their job to teach, but it's not part of their job to babysit. The vast majority of all allied healthcare professionals, so doctors, nurses, pharmacists, midwives, physiotherapists, occupational therapists, they're really happy to teach any students, and particularly medical students. The second thing that I would really recommend you do is to arrive every day with a goal or a set of goals that you're going to try and complete that day. The doctors who you're attending on the ward, they will have no idea where you are in your curriculum. They'll have no idea at what point you're learning you are. They probably won't even know what year you are, and they might not even be expecting you to turn up. So it's up to you to have turned up with something that you're going to do that day. For example, if you're going to go into NICU, so the neonatal intensive care unit, and you're going to follow the neonatologists, why don't you decide, okay, today I'm going to be doing new baby checks all day. So you find whichever the doctor is who's doing the new baby checks, and you say to them, "Hi there, I'm Connor Diblin, I'm a 4th year medical student here at King's. Would you please mind if I followed you and assisted in some of the new baby checks? I've already looked up how to do it, so I feel a little bit confident, but I'd love to watch you do a couple and then maybe have a go at myself. By the way, I've got a clinical skill that needs signing off for my new baby checks. Would you mind doing that?" Now the doctor knows who you are, they know why you're there, they know that you're keen and you already know a little bit about whatever it is that you're supposed to be doing that day, and you've given them a goal. you have also kind of flagged that you're going to be asking them for something, which is that clinical sign-off, which is part of the reason we're all going to clinical placements. Number 3, hopefully again it's an obvious one, but it's one I'm going to remind you to do, and that's be prepared to engage. It can be really irritating for a doctor or a clinician of any kind to have prepared some teaching, to have come to the ward that day ready to give you some bedtime teaching or to give you the lecture that they've prepared, only to find out that the medical student isn't engaging with it. The point of the clinical experience isn't really to learn the theory of how to do something. You should have a bit of a framework in your head. It's how to execute something. It's all of the little things. It's the how to build a rapport while you're doing a clinical skill. I'd recommend thinking about whichever ward or clinical placement you're going into and trying to think of the common clinical examinations you might have to do, some of the common presentations you might have to do, and the common differential diagnosis that might be made. Treatment is something that comes much later. I'm only starting to think about treatment now in 4th year really, and even in 5th year, treatment is always only secondary to having a diagnosis. My last thing that I will plead with you to do when you're on the wards is to ask and answer questions from the healthcare staff. And healthcare staff means everyone, from porters, HCAs, nurses, all of the allied healthcare professions, not just the doctors. If you don't know something, and you haven't done the reading or you're seeing something new for the first time, just ask. You're not a doctor yet, or you're not a nurse yet, or you're not a healthcare professional yet. So you're not actually expected to know everything. This is the opportunity for you to see something new, ask about it, and then learn about it. It's such a fantastic experience and it's such a fantastic way of learning. The same thing is true on the other side. So if you're shadowing someone, you're following a doctor around and they ask you a question about something, just give it your best shot. You're not a doctor, you're not expected to know the answer, and actually you'll often be surprised with how impressed they are about how much you do know. The questions that are being asked of you by a consultant or by a doctor or a nurse, they're not there to belittle you or to embarrass you in front of your friends. They're there to promote your learning. For me personally, I think it's probably the questions that I've got wrong in front of a consultant, 2 registrars and 3 nurses and several other medical students that I've actually remembered the answer afterwards. And so those experiences, it gives you some context. It gives you something to remember, and that's the best thing you can have for your learning. So you've got 4 things that you're going to be planning on doing now. I hope you took some notes. We're going to move on to some things that you should not be doing at clinical placements. The first is probably the most important, and it's something which I think if you are doing a question whether you should be there at all, it's something which we all learn for our interviews, and it's do not dismiss the other allied healthcare professions, okay? You're not there to only talk to doctors and to only learn what a doctor does. Especially for students in the UK, you're moving into the NHS, the National Health Service, which is a healthcare system run by allied healthcare professions, okay? So that's everyone that works in healthcare. Everyone that works in healthcare matters, and you as a student have so much to learn from every single one of them. The vast majority of people working in the healthcare profession are not doctors. Nurses and HCAs probably make up the biggest proportion, and again, you have a lot to learn from them. Nurses, particularly on the wards, they're there full time. So doctors are only there for maybe 6 months to a year at a time at most, apart from the consultants. The nurses are there full time, okay? They work there, they almost live there. Doctors, they're just visiting. So if you need to know something about the ward or the hospital, I would really recommend asking a nurse. The second thing that you should not be doing on your clinical placements is turning up and expecting someone to find something for you to do. Yes, you've been given a timetable by your medical school, and yes, I agree, a lot of the time the timetable you've been given doesn't actually match up the reality of what's happening with patients on the ward, and so you turn up for something expecting one thing and find either nothing or something else. But if you want to be involved in something happening in the hospital, you have to be there, you have to ask to be involved, and then you have to get involved. The third thing, this is entirely for you, and it's please do not be passive in your learning. Okay, learning is an active exercise. In order to learn something, you need to actively do something to push it into your brain, whether that's repetition, whether that's kind of getting hands-on, whether it's asking questions or even getting a question wrong. It's these events and these experiences that mean that we remember stuff. What I'd really recommend is keeping a little pocket notebook with you. I actually have mine here. It's one of those little moleskin ones. This is small enough to fit in the pocket of any scrubs, any clinical placement clothes I'm wearing. And it means that if I see something new and interesting, I can write a note of it, and then I can take that home at the end of the day or the end of the week, and I can have a little read up about those things that I learned that were interesting. And again, it's context. I keep saying this, and I keep saying it because it's important. You're going to these clinical experiences to learn in context. This is your chance to have learnt about something in the classroom, to then go and see something and be like, oh, that's what that actually looks like. The last thing I'm going to ask you not to do is to please don't just give up on your learning. There are always going to be good days and there are going to be bad days. Take me, this week, in Monday and Tuesday, all of the clinics I was supposed to be going to were cancelled. And I could have just said, well, they'll probably be cancelled Thursday and Friday, what's the point in going in? But I went in Thursday and Friday, and Thursday morning and Friday morning, I had some of the best clinics I've had this whole placement. Monday and Tuesday I also didn't just lie in bed. Granted, I lay in bed for a lot of the day, but I also got up and did a bit of work, did a bit of reading about what I could have seen if I was in that day. When you get into these clinical years, there's a bit of an unsaid assumption. You're kind of entering into this unspoken contract with your medical school, whereby now that you're a clinical medical student, you've actually taken a lot of your learning into your own hands. So a lot of that responsibility is now yours. And that's it. That's my 4 do's and 4 don'ts of clinical experiences. Hopefully you can take as many of these on board as you can and have great clinical experiences, everyone. Thank you so much for watching this far. Those of you who are still here and still with me, I'm going to talk about what to do when you have nothing to do. This is an increasingly common occurrence, unfortunately, because of coronavirus, because of decreasing how many people are allowed in any room at any one point. There's still a little bit of having to ration personal protective equipment or PPE, and it does mean that as a medical student, sometimes you're definitely not high priority to get in there or get on the ward or get into a clinic. Unfortunately, increasingly common and kind of unavoidable in the world we live in is that a clinic might be cancelled, or you might get to a ward and there really is nothing that you're allowed to do on that ward. So if you do end up in one of these experiences, first of all, I'm sorry that's happening. I've had quite a few of those in the last year, but there are 3 things that you can spend your time doing and be super, super productive. First of all is clerk patients and feedback to the doctors without them asking you to. Obviously you need to ask someone, because as a medical student you are there as a guest. I would really recommend finding the nurse in charge or the matron for that ward, asking which nurse is in charge of the patient you want to talk to. Just go and have a quick chat with that nurse and say, hey, is the patient in bed? 10. How are they doing? Would you mind if I just quickly go and have a chat with them? I shouldn't be more than half an hour. Gives you an amazing opportunity to go and see a patient and clerk them as if they were just presenting to the hospital. You can not read any of their notes apart from, check their name and date of birth and who they are, but you can turn up to the patient and say, hi there, my name's Connor, I'm a 4th year medical student. I mean, if your name isn't Connor, please don't say that, but you can say your name. And then you can say, would you mind if I just have a quick chat? Patients are often really bored in hospital. Hospital is a very boring place when you're sitting there and just having to get better slowly over time. And so they often really appreciate having a chat. You can then take that and go and feed back to a doctor. You can compare that maybe to the initial assessment that doctors had made. And you can spend your time then thinking, what's my differential diagnosis? What might be the treatment that I would recommend? What further examinations would I like to do? And again, you can compare that to their notes and you can say, oh look, I hadn't thought about getting them an abdominal x-ray or whatever it is. My next thing to say would be, this is your opportunity to catch up on lectures. Let's be honest, there probably isn't a single medical student who isn't a little bit behind on watching these online lectures, that are, especially the ones that are recorded, where you don't have to watch them live and you get to watch them in your own time. Well, if you turned up to a ward in the morning and there's nothing for you to do all morning, and then you're supposed to be at the ward in the afternoon, this is your chance to not go, well, that's it, and go home and then you just sit on your sofa for the rest of the day. Go and find the doctor's office, go and see if there's a library that might be open in the hospital, and watch that lecture that you haven't been watching for the last month. You can take some notes and then go and get some lunch and then come back to the ward in the afternoon ready to get on with whatever it is you need to get on with. The last thing, and it's probably pretty obvious, but this is a great opportunity to catch up on some life admin. We're all adults now, we're all constantly a little bit behind on a bit of life admin or productivity, so this is your chance that you can send off some of those emails you were supposed to send off 3 weeks ago. It's your chance to plan your following week and think about what are those things you need to read before you go into next week's clinics, and it's your chance just to have a little bit of a break. Like I said, I'm a 4th year medical student. I've still got 18 months of being a medical student before I graduate as a doctor, I would really welcome any recommendations you might have for me on how I can improve my clinical placements. Anyone who's new to this channel and has amazingly watched this far, thank you so much. Please drop me a like, maybe a little subscribe, and I'd be so grateful. Thank you very much.